According to United States Census Bureau, the most recent published estimates of the population in the city of Miami Gardens was over 100,000 people in 2015. Of this figure, 76.3% of them are African American, 22% of them are Hispanic or Latino, 18.3% of them are white. The area being addressed here in this presentation is the effect of poverty on health concerning the population in the city of Miami Gardens. The major overarching problems that I've identified is the problem of access to health care. There are 6 major issues that I've identified, which are racial discrimination, poor education, poverty and low income, marginalized people, uninsured people, and the lack of healthcare services available in the community. These 6 other issues that I've identified ties into the main overall problem which is being presented in this presentation. The order that I have mentioned, the 6 issues, are in order from greatest impact on the community to the least impact. It will be shown here who is most impacted and the barriers to healthcare. As mentioned earlier, the population of Miami Gardens is over 100,000 people. From top to bottom, the highest percentage of people in this community is the Black or African American and stands at 76.3%. Next is Hispanic or Latino, then white, then Asian or Alaskan. Asian or Alaskan is only 0.8% together. Of the total number of people in Miami Gardens, 80.3% of them are high school graduates or higher, and only 14% of them have earned a bachelor's degree or higher. The total number of people currently in the labor force, which is classified as the number of unemployed and employed, is only 61.6%. This is according to the United States Census Bureau. It is evident by the data and historical norms that the group that will be most affected by poverty is African Americans. Being 76.3% of the population lends to that fact. The economic and political structures which sustain poverty and discrimination need to be transformed in order for poverty and poor health to be tackled. This is according to healthpovertyaction.org. The historical norms and discrimination still rings true today. The national average current unemployment rate is 7.9%. Miami Gardens' unemployment rate is 13%. The median worker income is about $24,867. This is about $2,000 a month. From this fact alone, one could see how it would be difficult to afford rent, food, electric, gas, and normal monthly expenses. According to the United States Census Bureau, persons in poverty in Miami Gardens is about 23.1%. The national average is 13.5%. Thus, Miami Gardens' poverty rate is 9.6% higher than the national average. Who is affected more? The unemployment rate among Black or African Americans is 13.6%. The national average is 14%. The unemployment rate among Hispanics is 10.3%. The national average is 9.6%. And the unemployment rate among whites is 9.6%. The national average is 6.8%. Black or African Americans are the largest group in Miami Gardens and also are the most unemployed. And after that is Hispanic and Latinos. As a result, these indicators makes it evident that Black or African Americans make up most of the 23.1% poverty rate, and then after that, Hispanic or Latinos. The number of homeless people in Miami is about 4,235, according to the Miami Herald. There are a number of determinants of health. The ones pertinent here are income, which shows that the higher the income, the better the health. So the higher income is linked with better health. Education, which shows that people whom are more educated tend to have better health. It is harder to prevent poor health if healthcare services are not readily available or easy to access. Nutrition and your geographical location is also an important indicator on your health. In Miami Gardens, 29.2% of people under the age of 65 were without any type of health insurance before the Affordable Care Act. Meanwhile, the national average was 10.5%. And for those that did have health insurance, many of them were undercovered. Persons without health insurance often don't seek medical help until they reach the end stage of their issue or disease process, where in many cases it's too late. According to healthpovertyaction.org, poverty and poor health worldwide are intrinsically linked. Poverty is both a cause and a consequence of poor health. Poverty increases the chance of poor health. Poor health, in turn, traps communities in poverty. Infectious and neglected tropical diseases kill and weaken millions of the poorest and most vulnerable people each year. This is according to healthpovertyaction.org. According to Sylvester.org, Miami Gardens is a medically underserved population. There are not enough primary care providers available. There are no hospitals in the city of Miami Gardens, but there are numerous private health centers such as the Jesse Trice Community Health Center and North Dade Health Center that provides free health care to low-income and uninsured patients. As I mentioned above, oftentimes the community is uneducated about these programs and are unaware of such services and are unable to take advantage of these services, sometimes due to overcrowding at these centers. You may get appointments 3 months out when your issue needs to be dealt with today. So because of these issues, lots of times patients go to the ER for emergency services when these issues could have been taken care of by primary care providers earlier in the process. Other barriers to health care are doctor's fees, co-pays, transportation issues, and the threat of losing one's property due to taking time off of work to fix a health issue. Miami Gardens has a mixture of immigrant groups that are marginalized by the system, and oftentimes these people are afraid to seek care until it is too late. Around the world, poverty is prevalent and is oftentimes caused by a number of factors such as racial injustice, political greed and corruption, exploitation of a particular group in both first world nations, known as industrialized nations, and third world nations, known as underdeveloped nations. GlobalIssues.org mentions that you may have a first world nation, but only a few people are doing well, while the rest of the nation is suffering. On the other side, you might have a third world nation with the majority of the people doing well, but oftentimes this is almost never the case. Coupled with inequality, it is noted by GlobalIssues.org that health within rich societies is related to income differences. It is also related to social problems, which says that social problems and health are worse in unequal countries. Mental health and problems exist in greater rates in unequal countries. Drug use exists at greater rates in unequal countries. Life expectancy is longer in equal countries. As you can see from these indicators, these issues are likely when certain groups and communities do not have appropriate access to healthcare and are deprived of healthcare. Many of the people in these nations around the world are marginalized people that are sometimes uneducated and have limited upward mobility. The greatest thing, in my opinion, that the nurse can do in the community health setting, especially when dealing with the underserved, disenfranchised, and/or impoverished, is to become educated on this very topic. It is also important that the nurse further their education, which will contribute to an increase in their scope of practice, while allowing them to gain knowledge and expertise necessary to function as a community health nurse. According to the Journal of Clinical Nursing, the community nurses does not act alone, but operates in a multidisciplinary team while functioning in 6 domains. The 6 main roles that the community health nurse functions in is as an advocate, supporter, coordinator, educator, team member, and assessor. The role of advocate is to advocate for the community, put the community interests first, and the supporter listens to the community and make sure that the community's interests are represented before any of the other healthcare members' agendas. The role of the coordinator, which is the nurse, liaises with other members of the multidisciplinary team, engages other professionals for input on a case, and coordinate with social work clients, and family members. Okay, the nurse is an educator, which educates the community in all areas of concern. The community health nurse is also an assessor, which assesses any issues or problems that need to be addressed or corrected.